So welcome. My name is Dr. Bree. I'm a physical therapist here at Holistic Healing Center. And I'm really hoping that everyone can take a little something away from today's webinar with the changing scene of the workforce and our lifestyles. I think taking care of your neck is going to be extremely important. It is important now and more so than ever. So just a couple of things. Today, at the end of this webinar, you'll all have the opportunity to schedule a free 15-minute telehealth medical screening with one of our physical therapists. And during that 15-minute medical screening, we can, go ahead and evaluate and kind of see what's going on. The other thing is I want this presentation to be super interactive. So we have that chat there. Please use it. Ask questions throughout the webinar. Let us know, what your thoughts are. And I have Dr. Nancy with me, our other physical therapist, who is absolutely awesome at, answering your questions and all. All right. And let's see, lastly, just keep using that chat, like I said. And any questions that you have at the end of the webinar, I'll be addressing as well. I will do my absolute best to get to all of your questions. If I don't, that is certainly something that we can go over in that free 15-minute medical screening. All right. A little bit about myself. I am Dr. Bree. I got my doctorate of physical therapy from Quinnipiac University up in Hamden, Connecticut, back in 2014. Since then, I started my career out in Austin, Texas, and then moved on to Denver, Colorado. And in those places, I got experience in home health physical therapy, inpatient rehab, and then finally outpatient orthopedics. I have a specialization in balance training. I have a certification in what's called LSVT BIG, which is for individuals with Parkinson's disease, as well as certifications in kinesiotaping, and about to be certified in remote ergonomic assessment. So really excited to get started with that and help as many people as possible. My motto as a physical therapist is movement is medicine. Every day I come to work, I'm absolutely amazed at what we can do with our bodies as far as healing ourselves with movement and medicine, without medicine, and exercise and movement rather than medicine and surgery. So, that's really the name of the game. Here at Holistic Healing Center, as the name implies, we are a very holistic approach. We have an amazing multidisciplinary team of naturopathic doctors, physical therapists, acupuncturists, medical massage, and we do cupping. We do a bunch of different techniques, and the goal is to keep your body in balance, restore your quality of life, getting you back to those things that you love to do. What we want to do is really facilitate that healing process and meet your body where it's at. So an example, just recently I had a patient come in and she was pretty upset and, said to me, I couldn't even walk from my car into the building. I don't know if I should be here. And what we were able to do is give her exercises, stretches, and things to do that were appropriate for the level that she was at. And through those exercises, those stretches, and those manual techniques, we have been able to get her back in the garden. She was in the garden, I think, 3 hours over the weekend, which is an amazing, amazing progress. All right, so I want to start things off with a little question for everybody. Has anybody recently started working from home? I know that the workforce has really changed over the past year, and so I'm curious, what you guys have experienced, or if you've just been a little bit, home more than usual. let us know in that chat. Like I said, Dr. Nancy's on that chat. And this is, by the way, this is Rosie. She is my doggy sister-in-law, and she is not posed in this picture. This is her just coming up to my laptop. So it was pretty cute. But so since this all started, they're now thinking that by the end of 2021, 25 to 30% of the workforce will be working from home, which is a significant portion of us. And that's a significant disruption in our normal routine and different change from what we're used to. And because of these changes in our in our routines and our postures, has anyone experienced new pain in the past year? Let us know in the chat. Anything different that you've experienced over the past year that you never had before, new popping up. So this pandemic has started over a year ago now, and technically, pain is considered chronic when it lasts more than 3 months. So if you've had pain since the beginning of the pandemic, that pain is technically chronic now. And what they're finding is that chronic pain is associated with immunosuppression, with depression and social isolation, all things that we are trying to avoid right now. So it's really important that we nip this in the bud as soon as possible so that we avoid that chronic phase of your pain. A little bit about what we're going to go over today. First, we'll talk a little bit about the neck because it is important to have a background of how the neck is structured and what the structures that are involved. Then we're going to go over tips to improve your posture, reduce your neck pain, and reduce your risk of injury or that pain becoming chronic. And then we'll go over a little bit about why choose physical therapy to address your neck pain, and why specifically to choose telehealth physical therapy for your neck pain. And then we will go over those questions and answers at the end, as well as Dr. Nancy answering them throughout the webinar here. And then as a reminder, stick around till the end and you'll have that opportunity to schedule a free 15-minute telehealth screening. That will be done via Zoom, and you'll be able to schedule. I'll be sending out the link to the chat so that everybody can schedule their screening. So why am I doing what I'm doing? This is my husband, Mike, and I. And as I mentioned, we used to live in Denver. And Mike was commuting every day by bike, and then on the weekends we would go hiking, biking, and skiing, doing all the Colorado things. And we moved home, and Mike is now working from home. And with that huge change of being super active and then going pretty sedentary, he started experiencing a lot of neck pain. He was waking up with the neck pain. He couldn't work out because of the neck pain. And then at night when we sit down to watch New Girl, he was not able to get comfortable because of his neck. So what we did was I gave him a lot of stretches, a lot of different exercises for him to work on, incorporate throughout his day. He's feeling so much better now, and he's able to work out. And now that the weather's nice, we can bike again. And so what I want to do is that for all of you. Nobody should have to suffer with neck pain that's preventing them from working from home, playing with their kids, picking up their grandkids, traveling, exploring this beautiful earth. I know there's other limitations, but at least your neck won't be one of them. So I really, really would love to absolutely help you all to be able to do those things and get back to the life that you absolutely love. All right, so a little bit about the neck. You have 7 bones that go from your skull down the neck, and between each of those bones, there's a little cushion, and that cushion is kind of a fluid-filled sac, and it's filled with water. And then you have those 7 bones forming a canal where the spinal cord comes down through. And then each of those bones have a little hole where nerves come out. That hole is called the foramen. And those nerves go up towards the neck, down the arms, to the upper back. So there's a lot of different structures here. And then you also have ligaments that help with the structure and help with the stability, and the muscles that are aiding with the movement and also with the stability as well. There's a lot of, like I said, a lot of different structures here. So as physical therapists, we can determine exactly what part of the anatomy your pain is coming from without even imaging. We don't really even need imaging at all. All right, so pain in the neck is definitely a pain in the neck. Unfortunately, if it affects 30% of the US population a year, that's a lot. And most often it's adults between the ages of 30 and 50. And unfortunately, ladies, it happens more often with to us more than men. Some risk factors for developing neck pain include posture, obesity, smoking, repetitive lifting, screen time, and athletic activity. And I want to go a little bit more into screen time again because this is such a relevant problem in our society at the moment. What we call tech neck is the posture of your head being forward, your shoulders slumping forward, and your back kind of being rounded forward. And what that does is going to put a lot of strain on the structures in your neck. So those ligaments, those muscles, those discs that are filled with water are at risk for herniating into the nerves. And those bones are going to wear down a little bit quicker. Once your head is tilted about 60 degrees, that's 60 pounds of pressure on your neck. That's like having a 6 or a 7-year-old kid sitting on the back of your neck. So that's a very uncomfortable feeling, and we're doing it all the time. They say that in 2020, the average adult was spending 5.9 hours a day on digital media, and that was up from 3.3 hours a day just back in 2017. So this has gone up exponentially in a very short amount of time. Teens, unfortunately, are averaging 9 hours a day, and I'm sure that's even higher now because of all the remote learning that's been going on. So this is like a really, really big problem, and that technology is not going away. So we might as well, learn to adapt our bodies and learn to manage things as it comes along. So I want everybody to go into the chat and let us know if you are having neck pain, what does that pain feel like? Is it sharp, shooting, tight? Do you have jaw pain, headaches? Let us know. As physical therapists, we are listening to what you're saying and those key words that you're telling us your pain feels like. And that will help us determine exactly what tests that we need to do in order to figure out what structures the neck pain is coming from. So for example, if you tell us that your pain is like numbness and tingling down the arms, then that tells us maybe we need to look a little more closely at the nerves. Likewise, if you tell us that your pain is aching or aching or sore, we're going to look closer at the muscles in the neck. And then finally, if you tell us that it's more of a throbbing or pulsing, then we're going to look more at the blood vessels and see if that's kind of where it's coming from. So all these words are a really good indicator of where we start to look at and then how to proceed from there. All right, so how do we reduce your risk of developing neck pain? Or if you already are having neck pain, how do we prevent it from becoming chronic? And then how do we help you recover? So there's a couple of things here that I want to go over, a little bit of tips and tricks to help. The first thing is to create an ergonomic work from home setup. Now, even if you're not working from home, there's likely a place in your house where you're spending most of your time on your computer or your tablet or your phone. So think about that, and have you made that set up to cater towards you, or are you just kind of sprawling out wherever you are and sitting there for a long time, and then your neck is hurting as a result? The second thing is to stand up and move throughout your day. Again, with it's been tougher because everybody's working from home. So, you might not be incorporating that movement throughout your day. One of the great tips that I came up with recently was, everybody's been commuting or had been commuting in the morning and the evening, and now you're not commuting at all. So you can kind of build in that time and use that as the time that you're taking a little walk or doing some exercises. So if you were able to make time for your commute to the city or wherever it was, hopefully you can now incorporate it into your day with exercise and movement. And then lastly, performing some sort of postural stretches and exercises is going to be really important in kind of managing things at home. So your physical therapist can kind of come up with very specific movements and stretches for you, because everybody's different and everybody is going to have different muscles that are tight, different muscles that are weak. So we can really tailor those exercises towards you. So think about these three things. What can you check off this list that you're doing daily? And what are some things that you've been neglecting or can work on a little bit more? Let us know. All right, so this is a nice little diagram of the textbook way to sit at a desk. So this is a really helpful kind of template for where to start. But, like I said before, everybody is different, and us as physical therapists can customize this setup to you. And for example, everybody should be looking at the top of their screen as they're working on the computer. So you want to set it up so that your eye line is almost level with the top of the screen. However, if you wear bifocals or progressive lenses, that angle is going to change a little bit. So that's just a very quick rudimentary example, but this setup is going to look a little bit different for everybody depending on their bodies, where they're at, what the pain is like, and then of course what is available to them at home. Next, we want to really support your curves. My husband and I always laugh, and this meme is kind of a indicator of that, that shrimp position. We call each other out all the time saying, "You're sitting like a shrimp." And we try to motivate each other to get up and kind of move and reposition ourselves a little bit. But unlike a shrimp, our spines are this ingenious design. And in the neck and the lower back, you have this C curve. And that C curve is called a lordosis. Whereas in the mid back, you have a reverse C curve called a kyphosis curve. So we really want to be supporting those that curvature of the spine, because it is that curvature is really important in reducing the compressive forces that we're putting on ourselves every day. All right, so there used to be the saying, no pain, no gain. When you're doing stretches and movements throughout your day, that is not the point at all. What we want to do is have you listen to your body and meet your body where it's at that given time. So you really don't want to be pushing yourself and, oh, this is supposed to hurt, or this is supposed to, I'm really supposed to feel this. We really want those stretches and exercises to be, again, tailored towards you. So which stretches are gonna help improve the flexibility of the muscles that need to be stretched? What exercises are going to be the ones that are strengthening the specific muscles that need to be strengthened? All right, so I want everybody right where they are to freeze. And I want you to freeze right where you are and notice where your head is related to your shoulders. Is it forward? Is it tucked back? Where are your shoulders? Are they rounded forward? Are they pulled back nicely? What's your jaw doing? Is it tensed up? Is it clenching? So think about these things, how you're sitting, and just be aware of that. That awareness is the first step to figuring out what your body is going to need. I want to try a couple things with everyone, and the first thing you're going to do is kind of sit and just squeeze your shoulder blades together. Hold that for a few seconds, and then relax. And how does that feel? Did you feel a stretch in the front of the chest here? Did you feel like that was a big effort for you? Did it feel kind of nice? It should. If it doesn't, you can always adjust the angle or how far you're pulling back. But that's called a scap retraction, retracting those shoulder blades there, and hopefully should feel nice. Now, the second thing that I want everyone to try is to take their chin and kind of bring it straight back towards the wall behind them. And try not to look down. You want to take that chin and go straight back behind you. So you're almost making a double chin. And don't worry, I cannot see any of you, so you can, do this how you please. But yeah, it doesn't look that pretty, but that's called a chin tuck. And what that's going to do is help strengthen the deep stabilizing muscles in your neck and help stretch the ones that tend to be overworking when we are clenched up and working at our computers or on the phone, whatever it might be. So again, that should feel kind of relieving to the stress in your neck. And doing those type of things are going to really help you get that awareness of where your body is in space. So you can do that throughout your day to kind of figure things out and see how you're feeling. All right, so why should we do physical therapy in order to tailor the treatment towards you? Well, PT has been shown to be more effective than surgery. It's more cost effective than surgery, and it doesn't wreak havoc on our bodies like pain medication or even injections. Believe it or not, you don't need a referral to go to a physical therapist, at least in the state of New Jersey. You can come right off the street and come in for an evaluation. Most insurances don't require that referral at all. The reason for that is that PTs are considered primary care providers. So that means we are trained to assess you and determine if physical therapy or any other medical provider is appropriate for you. So I want to look at a little bit of the difference between the traditional healthcare model and what we do here at the Holistic Healing Center, which is more of the holistic healthcare model. So traditionally, if you have pain, you go see your primary doctor, and then likely they're going to send you to a specialist, and then that specialist is probably going to order you an X-ray, an MRI, and send you home with a steroid and a muscle relaxer. And then from there, you're not getting better, so you go get surgery, and then you're in more pain, and you have to take more meds because you're in pain from the surgery. And then after that, you might go to physical therapy. This is a lot of steps, and it's a lot of headache, and it's a lot of cost for your insurance company and for yourself. But in comparison, if you go with the holistic approach, you have pain, you go right to a physical therapist, and then that physical therapist is going to help you get back to your life and make you feel a whole lot better without medication, without any surgery. This is the way to go. So telehealth has come up a lot in recent days, in the last year or so. But why telehealth for physical therapy? Well, it's in your own home, so we can see exactly where you're working, what you're doing, how you do it in your own environment. You get more one-on-one time with the physical therapist. So it's only 30 minutes of your day, which is, I know time is a constraint for everybody. There's no commute to and from the office. And if you don't have any equipment, that is no problem at all. We are trained to get very creative with the daily household items that you have around you. And whatever you have, we will work with it. So what do we do with a telehealth visit? First, we would do a very thorough assessment, evaluate, see where your pain is coming from, what you need. We can evaluate your work from home setup and make it tailored towards you. We can give you lots of exciting exercises you may not even have thought of, you may not have known you needed, because again, we are figuring out exactly which muscles are tight and which muscles are weak, and we're going to tailor those exercises to you. And then, of course, we can always give you those answers to your health-related questions that your regular primary doctor probably doesn't have the time to answer. So it's nice to have somebody that you can check in with there. And then a lot of people are always saying, like, well, okay, if I'm doing telehealth, how do I get the hands-on treatment? That, of course, is still an important part of what we do. And what we do is teach you how to do manual techniques on yourself using, again, household items. And we can also teach you or teach your loved ones how to do those manual techniques on you as well. So if you still want to come in, we are here. We are open, we are clean, we are safe. Again, we have access to that multidisciplinary team. You can do acupuncture, you can do cupping, you can do massage therapy, and have access to our holistic doctor and our holistic wellness programs. Unlike most physical therapy offices, we have private treatment rooms. So that's really nice. Our team makes you feel like home when you come in. We do that hands-on approach always with a doctor of physical therapy. And then, of course, you have access to our gym equipment here as well. If you don't have insurance, no problem. We do have private pay options. We also, if you want to spend more one-on-one time with the physical therapist, we have the opportunity for you to go with our VIP program. So you can pay for more time with the physical therapist. And then we also have a wellness program if you have already graduated from physical therapy and you want to just be under the supervision of the physical therapist. That's definitely a great option as well. So we would love to help you feel your best faster. That is the goal. We want to get you back to those things that you love and back to the things that you are doing without, having to modify or cancel or change plans because you're having neck pain. Telehealth PT is a great option for you. They're finding wonderful, now that the research is coming out, there's been great response and really great compliance and really great response from the patients. So we are happy to start that journey with you. All right, so everybody that is around can qualify for that free 15-minute telehealth medical screening via Zoom. During that screening, we'll talk about your overall health, your pain, how your pain is affecting your life, and then we'll come up with an action plan together of how to get started and what we need to be doing for you to help you get back to your life as quickly as possible. All right, so check out the chat. I'm going to drop that schedule link there. And if you're having trouble with the scheduling, you can go ahead and give us a call or you can text us. Here are our providers. So I have myself, Dr. Nancy, who's the amazing owner who has been chatting with you guys throughout the webinar. And then Dr. Raj is awesome. And then we also now have Dr. Kim, who's also amazing. So when you go book with us, you'll be with one of us. And then just wanted to show you guys, if you need to get that number down to give us a call to, you can either call or text us, add us on Instagram, Facebook, shoot us an email. We are here. We are happy. We are so excited to meet you. And then I love to get any questions anybody else might have. So feel free to drop it in the chat. Again, if I don't get to your questions, I will definitely get to them in your 15-minute screening. Oh, so appreciative of everybody. Thank you so much. This has been absolutely wonderful speaking to all of you. I hope you got a little something out of what we talked about. I'm ecstatic to be here and help as many people as I can. So, I'm happy to get started with all of you. All right. So if nobody has any further questions, I will end here. So again, thank you all for attending. I really appreciate it. Looking forward to meeting you all soon. Take care.